Good day to everyone and welcome. It's my pleasure to welcome Laura Anderson and Patrick Drewry of Change Healthcare to have an important discussion this morning. Laura and Patrick, why don't you go ahead and introduce yourselves, tell us your titles and roles in the organization, and then we'll ask you some questions.
Sure, thanks, Mark. Good morning, everybody. I'm Laura Anderson, and I'm the Chief Product Officer for Revenue Cycle Management Technology for Change Healthcare.
And hi, everyone. Patrick Drewry. I'm Vice President of Product Management, overseeing patient engagement at Change Healthcare. Thanks for having me.
Wonderful. Thank you both. Well, let's ask you some questions that might be of interest to our audience. Could you share with us some background, your perspective on the current status of the patient experience? How has the patient's role in their healthcare journey evolved in recent years? How do you see that process?
Right, and I'll take that one. And so I think, before I answer the detailed question, it's the answer's in the question itself, which is recognition that there is a patient in a healthcare experience. And I think over the years, for a long time, it's really the patient is at the center of healthcare, but it's been more so about the provider's experience in navigating that healthcare journey. And I think in recent years, we've started to acknowledge that there is a patient on the other side of those experiences. And so now you're starting to see various, focal points around, self-service scheduling, price transparency, finding a provider, understanding care options, things like this pop up. And so now that there's recognition, we're sort of flooding the patient with information and communication channels. And I think right now what we're facing is we've acknowledged that there's a patient, we've acknowledged there's various touch points in that journey. And now we need glue, sort of someone to bring it all together as an end-to-end, kind of lifetime relationship.
Mm-hmm.
Absolutely. So where does technology, including AI, including artificial intelligence, where does technology fit into that? What is it? What is it that our audience needs to know about integrating technology into this journey around creating this patient experience?
Right, and so there's a lot of ways to answer. So I'll give probably two examples or two touch points here. Which so when I mentioned the glue, someone to bring it all together. This is a highly technical. This is a technical challenge that I think we need to think about how to reduce the noise, simplify things for patients. Bring levels of automation to them that I think they're not used to in our industry, and so that is all achieved through technology, various capabilities and techniques. And I think as far as the implications go, and people again do not generally think about healthcare as a business. But it is a business. You need to manage your revenue and be profitable, and think about your competition and your patients as consumers or customers, and those who do not meet the patient demand on where we are today will struggle to maintain relevance in their markets. And so I think it's we need to balance sort of the need for technology to do the right thing for the patient with also thinking about things like operational efficiency and kind of raising impacting your bottom line.
Absolutely. And in that context, where are we with price transparency? Let's talk about what is the value of price transparency for consumers, and how does technology play a role in that?
Yeah, I'll take that one. So, we talk a lot about how we're trying to make the healthcare journey or experience just like any retail experience. And while we still have a long way to go from a retailization, for lack of a better term, of healthcare, price transparency is a really good example. So you're not going to order from Uber Eats or DoorDash in this environment of pandemic without knowing what your prices are. And it's as if, you're not going to go on any website to shop for an airline ticket without understanding how much you're going to pay. And how many times have you gone to the doctor's office, or somebody who's been in an inpatient environment where you have absolutely no idea how much you're going to get charged until you get the bill? So putting aside any regulatory mandates, it's just good business to be transparent with our consumers, patients, us, about what it's going to cost them, whether it's self-pay or out of pocket. And the way to be able to do that is through technology and connecting the information coming back from the health insurance companies to the provider to be able to share that information with the patient, either prior to visit or when they're at the visit.
Yeah. And in that journey of 1,000 miles around pricing transparency, how many miles have we gone, Laura, so far as an industry?
I love that analogy. We're getting better. We as an industry, and again, and I would say we had to get better because it's been federally mandated with, being able to share, but it's not all services. It's, a subset of all the services out there. So I would say we're probably in our journey, not even halfway there. We still have a long way to go, because to me, it's not just about what the cost is, but how you're going to pay for it. And, thinking about compassionate pricing and thinking about compassionate care. And we know that the third largest payer these days is us, is people, is consumers. So I think exposing how much something's going to cost is just the tip of the iceberg. I think really in order to take better care of our consumers and really, Patrick's right, healthcare is a business, but I'd like to think of it as, or the goal being, it's a compassionate business. It is healthcare after all.
Absolutely.
I know I'm stating the obvious.
Yeah, no, it's true. And I think you're touching on this incredible kind of nexus point between all these different elements, right? It has to be run as a business. It has to be compassionate. It's about patient care. If you're paying for something, it's because you've had care delivered. So it's different from DoorDash, not knocking DoorDash or anything like that, but it is different. So how do you create a cohesive journey out of this, Laura? How do you, what elements are involved so that the clinical journey and the financial journey of the patient come together in a way that the patient can understand?
Yeah, well, the way that we're approaching it, Patrick and I are approaching it, and really our company, but it's really, I would hope that this is the way that the industry is going to approach it, is if you make it easier for people to get care, understand their care, understand where to go for care, then paying the bill becomes almost seamless. In other words, we always personalize patient engagement, meaning I talk a lot about this. First of all, I'm lucky that both my parents are still around, but I have aging parents, and my dad is battling with 3 chronic diseases. And when my mom is trying to navigate through all of the providers, the palliative care nurses, and things of that nature, do you think she's thinking about how she's going to pay the bills? No, she's thinking about how to get my dad the best care that he can possibly get, and making sure that the scheduling is seamless, that she understands where to go, why she's going, making sure that she's getting that information about all of his meds, making sure that there's not contraindications. And so where I'm going with this is, I think that if we as an industry do a better job with pre-visit outreach, patient outreach, getting that patient in the door, making it easy for them to see their providers. Why are they seeing their providers? And then being transparent with them about, oh, by the way, Mrs. Gross, this is how much the bill is going to cost based on you've got Medicare and supplemental insurance. It's sort of the financial piece becomes sort of a natural side effect. Does that make sense what I'm saying? Patrick, you have anything to add to that?
Yeah, and I would add, even back to like the original, the original question, it's not about us and like our specialties and our expertise in these various domains. It's about the patient, and the journey they're on does not bifurcate clinical and financial. It's all happening at the same time, and so recognition of that is my number one recommendation to providers these days, is to say, when you're starting to map out what is our patient experience, it can't just be what is our patient financial experience, what is our patient clinical experience, because inherently it's one patient, one timeline, right?
Yeah. And that, Patrick, that actually parallels something. What came to mind as you were saying that is we patients, we're all healthcare consumers, are also seen even in a clinical context as being parts, right? like my head is one part, my neck is one part, my heart is one part, my feet are a part. And the healthcare system has for so long treated patients as just a jumble of different parts. Like, we're here for your arm, right? But we have to think of the patient as a whole person. And that leads to my question: how can technology help to humanize revenue cycle management and improve the patient journey? We think patient care organizations have been so patient care organization centric in thinking about revenue cycle, right? How can we humanize this for patients, for the whole patient?
And I'll jump in there as well. So I think I think at the center of that question, humanize, right? It's everyone's going to have a different interpretation of that, and I think that's what's important. Is human beings are all going to be, their experiences, their backgrounds, their, what they're familiar with it's all different. And so that's where, when you align it to revenue cycle and what goes on with the patient payment journey, you need to meet that unique patient with something that helps them, prepare for that revenue cycle journey. And so, and then matching the market, what's going on in the market today, which is these are unplanned expenses. They are large expenses and they're opaque. People don't understand when they're coming or what it all means. And so our responsibility to humanizing this is to prepare them along the way of that, unplanned journey. They're sick, and the last thing they need is a several $1,000 healthcare bill. But that's the nature of what's going on. Is our system is they're a big portion of that. And so during this journey, how can we get them familiar with their obligation of payment? And then during their journey, how can we reach them and help them understand that there are options to help them meet that financial obligation so that they don't have to forego care, which you see so many people doing these days because they are scared and they cannot afford a healthcare bill.
Beautifully said. Laura, do you have thoughts on that?
First of all, I totally agree with everything Patrick said, and it was beautifully said. I think we need to simplify the experience through technology. So, I made the analogy of DoorDash, and I've got a recent college graduate and I have a freshman in college. And if it's not on a phone, they're probably not going to pay attention to it.
Yeah.
So we think about, Gen Z and, future generations and technology. It needs to be pretty seamless. It needs to be really simple. It needs to be like break down what's very complicated into simple terms. Another example I often think about is how many times with pre-visit forms are you asked the same question multiple times? Like, I don't need to be asked 8 times, do I have allergies? Why aren't you capturing that data and making sure that that data is collected and stored? So it's not like you go to a restaurant and the server asks you 8 times, are you allergic to peanuts? So it's basically
that's a great metaphor, right?
Yeah.
Because it's true. That's what happens in healthcare. Yeah.
Right. So it's to me, it's a little bit of applying common sense from other industries and making it really simple to use on devices that, people are used to. And I think that one of the biggest advices I give to providers when they're thinking about patient engagement is you have to, not everything is going to apply to everyone based on, it's basically like one size does not fit all. What works for my parents is not going to work for my kids in terms of what they want their healthcare experience to be. So my big focus is compassion, simplifying it through technology, and making it flexible so that we can, as best as we can, create a one size fits all sort of scenario through technology.
Right. And I think ultimately what you're both saying, I'll interpret you to yourself, is we've got to rework how we think about these processes and how we implement them so that consumers have a better experience and have a more transparent experience. I think we've all had this I've had this bizarre experience where I've received a bill in the mail and I literally cannot figure out what it is.
I mean, I've been doing it for 15 years and I still can't figure it out, right? And so if I can't do it, then how does somebody that lives outside of the domain understand it? And so
Exactly.
I think the points that you're making there is spot on. It's we've got to think about, applying, when we're applying technology solutions to this problem, we've got to think about the patient on the other side of that healthcare experience. And that patient, it can't just be a singular patient. It needs to cut across different generations, different education levels, different experiences and backgrounds. And I think that's ultimately we're at the cusp of being able to do all of that with technology. And so I think that's why it's a really exciting time for us.
Wonderful. Any last thought from you, Laura?
No, I think that was a wonderful closing, Patrick. It is exciting times. But I think, well, I would say it's exciting times, but it's also troubling times. And I think that we have an opportunity as an industry to try and make a positive difference and be positive change agents through applying technology to a very complicated healthcare problem by making the patient journey more seamless.
Yeah. I just read in a book on linguistics how it turns out to be an urban legend and not true that the word for opportunity in Chinese is the character of crisis and whatever. But still, the idea is true. Opportunity comes out of crisis, and we can learn from the challenges that we're facing that how to move forward and how to create a better and ultimately a more humane experience for patients as consumers in our system. So Laura and Patrick, thank you both so much. It's been great to be with you, and I know our audience will appreciate our conversation just now. Thank you.
Thank you, Mark.
Thank you.
Thank you. Have a great day, everyone.
You too.